UW Medicine has experts in reproductive health care, including abortion services.
We definitely are seeing patients who are coming from other locations to get care with us here, since we can still offer that. I will also say, and this may be surprising to some people, that because of the high percentage of Catholic healthcare facilities in our state, there was a bit of this anyway. So, many counties in the state of Washington don't actually have a secular hospital. And so those patients were previously needing to travel for this care also.
The medication Mifepristone remains widely available in Washington state.
The lawsuit in Texas didn't actually change accessibility in Washington at all at this point.
Several state laws have recently changed the landscape of abortion care access across the country. Here's Dr. Prager's advice for pregnant patients curious about travel.
Half the states are no longer providing what I would consider to be full spectrum healthcare for patients who are pregnant. Certainly not in the first, 2 trimesters, if particular complications might occur. And so I'm really telling patients who ask me about travel, which is a common thing for my pregnant patients to bring up with me, like, is it safe for me to travel? And I'm now asking where. Because if they're going to go to California, that's fine. They're not going to have a problem. If they're going to go to Mississippi and they're 8 weeks and they experience a miscarriage there, they may not get care that they want or that I would want them to have. And so really having that conversation and openly telling them, you may or may not get these sorts of care where you're going. What's our plan? It's been really traumatic for a lot of my colleagues who are living in states where abortion is now illegal or highly restricted, whether or not they are abortion providers, because we have lots and lots and lots of really high quality data that tells us not just that access to abortion decreases maternal morbidity and mortality, but it also, access to abortion also improves obstetric care in all ways.